Okay, make sure I stand in the right place here. Good morning, everybody. Today I am joined by the woman on my right who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli. Another familiar face to my left, the Department of Education Commissioner, Dr. Angelica Allen McMillan. We also have the deputy, two to my left, Deputy Superintendent of the State Police, Lieutenant Colonel Sean Kilcommons. We also have to my left the Acting Commissioner of the Department of Environmental Protection, Katie Angarone. And in the bullpen, we have in the audience Assistant Commissioner of the Department of Environmental Protection, Paul Baldoff, who can help answer any technical air quality questions. So we're here to provide an update on the alarming air quality due to the smoke that's continuing to drift down from the wildfires in Canada. I was on with the Canadian authorities last evening, and the scale of this is extraordinary. They said they had 10 million acres burning, that number was going to go up, they believe, to 12 million, that there are over 200 separate fires, and according to their senior authorities last night, 170 of them are out of, quote unquote, out of control. So we're monitoring the situation closely and coordinating with our state agencies and beyond our state as we need to, and you'll hear shortly from the folks beside me on what their respective agencies are doing. As Katie will mention, the DEP has declared another Air Quality Action Day for particulate matters for today, Thursday, June 8th. I think you've already made that decision for tomorrow as well, Friday, June 9th. In addition, state offices closed earlier yesterday at 3:30, and they opened later today at 10 a.m. this morning, again, due to the poor air quality. Our top priority, as always, is to protect the health and safety of all New Jerseyans, so we encourage everyone to take precautions and stay inside if possible. What we have seen is unprecedented. As I mentioned, the widespread nature and uncommonly high levels of fine particulate concentrations reaching the unhealthy category is of a historic magnitude. And poor air quality impacts everyone, and exposure to high levels of particulate matter can cause difficulty breathing, chest pains, and asthma attacks, as Judy will discuss in more detail. Given the forecast for today, we continue to urge strongly all sensitive individuals, especially, meaning those with health conditions like asthma, heart disease, lung disease, as well as our kids, pregnant individuals, and seniors, all of the above, especially to stay inside. Everyone should try and limit their time outdoors today and avoid strenuous activities. The most effective way to prevent breathing harmful particles from wildfire smoke is to stay indoors with the windows and doors closed. If you must spend time outside, please wear a mask, a good-fitting N95 in particular, and that will help limit irritation to your respiratory system. And if you're working outdoors, take more breaks if possible and shorten the length and intensity of any physical activity. As Judy and I saw time and time again during the pandemic, the heroic efforts of folks who have no other choice but to be outdoors and in the mix is something that we always have to be reminded of and tip our cap to those men and women. The State Police and Office of Emergency Management, and Sean will refer to this, are distributing N95 masks to those who need them. In fact, first thing this morning, State Police delivered masks to NJ Transit staff at multiple high-volume locations. So you can request an N95 mask from an NJ Transit customer service representative at the following locations: Newark, Penn, right across the street, Atlantic City, Camden, Trenton, Secaucus, and Hoboken. And over the past couple of months, the Department of Health, under Judy's leadership, had already distributed HEPA units and filters to over, I believe, Judy, 1,800 schools and over 450 child care centers. Those were originally aimed at COVID-19 safety, but those will certainly be helpful on a day like today. So this morning at 7 a.m. in Jersey City, the air quality index was 226. In Central Jersey, it was 237, and in South Jersey, it was 285. Those all fall within the very unhealthy range, meaning the air quality poses a risk certainly to those who are vulnerable, but frankly to everybody. The highest concentrations of smoke are expected to dissipate over the next several hours, and you've already seen the beginning of this and into the afternoon. However, later this evening, as Katie will no doubt refer to, the haze and smoke are anticipated to become more dense. To get the latest updates on air quality in your area, as well as fire and smoke mapping, go to airnow.gov. airnow.gov. I was also going to dep.nj.gov yesterday, Katie, you'll be happy to know, and Paul. But airnow.gov, I think, is an all-encompassing good place for folks to go to. I mean, one last observation. If anybody has any doubts, this past couple of days and what we're going to be dealing with for the next few, climate change is here. And unfortunately, this is our new reality. That disturbing orange haze in the sky, that smell of smoke and that burning in our throats, those are clear warning signs that the status quo cannot continue. And it only hardens our resolve to aggressively pursue the bold action our climate reality demands. In the meantime, we have no choice but to take precautions on days like this. So please, again, stay inside if you can, especially if you're in a high-risk group. With that, please help me welcome the woman who needs no introduction, the Commissioner of our Department of Health, Judy Persichilli.
Thank you, Governor. Good morning. As the Governor just said, staying indoors and keeping activity levels low during high air quality index days is the safest approach. At the highest risk are older adults, pregnant women, young children, and especially individuals with underlying respiratory diseases such as chronic obstructive pulmonary disease, particularly asthma, emphysema, and chronic bronchitis. Children are particularly at risk from exposure to wildfire smoke and poor quality air quality. This is because they breathe more air relative to their size and are more active than most adults. The health effects of wildfires on children can include chest tightness or pain, shortness of breath or trouble breathing, coughing, irritation of nose, throat, and eyes, and feeling dizzy or lightheaded. We recommend that you check the local air quality levels daily using sites like US EPA's airnow.gov and search by your zip code. For everyone, and especially our children, outdoor activity should be minimized and athletic or physical education stopped until air quality improves. Children with breathing problems such as asthma are at increased risk. They should be kept indoors until air quality improves. If your child has asthma, it is important to make sure that all their medications, including their daily preventative medicines and rescue inhalers, are available and close by. Some steps you can take to keep yourself safe include wearing a well-fitting N95 mask, especially if you must be outdoors. Dust masks that are commonly found in hardware stores will not provide protection against smoke and particulate matter that is impacting our state right now. And remember, children under 2, it is not recommended that they wear masks. And for children over 2 years of age, you know your child best, so you can determine if a mask is appropriate. Most important, for all of you, pay attention and listen to your own bodies. If you experience trouble breathing or worsening symptoms, seek medical attention. Also be sure to check on older relatives or neighbors who may be at increased risk. As noted, children are at more risk because they breathe more air per body weight and are much more active than most adults. They are also still growing and developing, so be aware of the signs of distress in your children. Because we recognize the significant impact of air quality on children's health, as the Governor shared, the Department of Health rolled out a CDC-funded program making free portable, high-efficiency particulate air filtration, HEPA filters, and purifiers to all New Jersey K-12 schools and early childhood education centers. The goal of the program is to provide layered protection from respiratory illnesses and address other airborne irritants such as dust, mold, and pollen. Although we began the program with COVID-19 in mind, it's proven especially timely right now. To date, nearly 1,800 schools and over 450 child care centers are participating in the program and receiving over 52,000 HEPA units. And this includes about 75% of New Jersey schools that we consider at high risk because of older buildings. At this time, we are closely monitoring the number of emergency room visits, total hospital admissions, and EMS transports for respiratory issues across the state. As with any threat to public health, the department is in constant and open communication with our sister agencies and partners to provide any necessary support to safeguard our public's health. Remember, stay indoors if you can. Close all windows, doors, and openings. Place your air conditioner to recirculate if possible. And stay healthy and stay safe. Thank you.
Thank you, Judy. Well done and well said. It feels like 1,000 years ago, but you will remember in February of 2020, our very first ever COVID-related press conference was in this room, and it was the subject of which was the Trump administration's funneling of the all air traffic and passengers out of the People's Republic of China into a handful of airports, including Newark Liberty. Feels like 1,000 years ago at this point. Thank you for your leadership. Please, I mentioned her earlier, please help me welcome the Assistant Commissioner in the New Jersey Department of Environmental Protection, Katie Angarone. Katie, come on down.
Thank you. This certainly is a challenging air quality event, and I'm thankful to the Governor for his leadership and to Commissioner Persicelli for ensuring that we're communicating regarding risk and the important actions that we can all take to stay healthy. Thank you, sir. Collaboration really with all of our partners here today is critical, and I'm thankful for it. While it's not uncommon for wildfire smoke to impact New Jersey and the Northeast region, the widespread nature and uncommonly high levels of fine particulate concentrations reaching the unhealthy, very unhealthy, and even hazardous categories in various parts of the state is unprecedented. So as a result, as the Governor mentioned, an Air Quality Action Day for particulate matter has been declared for today and tomorrow. And as we've also heard, this means that everyone, including sensitive individuals, should follow health guidance to limit or avoid strenuous activities and the amount of time active outdoors as appropriate. Forecasts indicate that the levels of fine particulates will remain elevated in the unhealthy for sensitive group category, but the conditions are very changeable, so awareness will be important. The event remains a developing situation that will continue to be monitored as the fires are still currently burning in Canada, and as long as they continue to burn in this area, the potential for wildfire smoke to impact our region persists. So we'll continue to monitor the situation and to provide the essential information that you all need to make informed health decisions. And as mentioned before, but worth repeating, you can monitor the air quality today and any day at airnow.gov. And you can also sign up for alerts on your personal devices at dep.nj.gov. And I must emphasize here that while the recommendations may feel novel and unusual, they are important for our health, so please do take them seriously. As our climate changes, the best available science indicates that events like this are likely to increase, so we must all work to be aware and ready to respond while we all do everything we can to reduce the impacts of climate change. So please listen to the advice of your health officials, protect yourselves by staying indoors, and taking any other actions they recommend. Thank you.
Thank you, Katie. Thank you, Katie and Paul, for being here today and for your leadership, and obviously Commissioner Sean LaTourette as well, so thank you. Obviously, we've got a lot of questions about schools. Not surprisingly, we've got another outstanding leader with us, the Acting Commissioner of the Department of Education. Please help me welcome Dr. Angelica Allen McMillan. Angelica, come on down.
Good morning, Governor Murphy and my fellow members of Cabinet. As the Acting Commissioner of Education, my highest priority continues to be safeguarding the physical and emotional health and well-being of our students and providing them with the best possible educational experience. In the wake of the ongoing Canadian wildfires and the resulting smoke and air quality concerns, I want to emphasize that we are taking a proactive and diligent approach to address these challenges to protect our students' learning environments. We are utilizing our partnerships with the New Jersey Department of Health and the New Jersey Department of Environmental Protection, relying on their expertise to inform strategies for school districts across the state. Recognizing the unique circumstances faced by each school district, we often work to empower local educational agencies to make their own decisions based on the specific health and safety concerns in their respective areas. Local leaders understand the needs of their communities. By providing districts with crucial information and giving them the ability to make decisions based on the advice and guidance of health and environmental experts, we are fostering a culture of responsiveness and adaptability that is crucial to meeting changing circumstances. That is why yesterday we shared information with school districts about current conditions and expert guidance detailing how to address and respond to poor air quality, including recommendations to limit outdoor activities on behalf of children who are more vulnerable than many adults to the effects of this air. I would also be remiss if I did not commend the educators, administrators, and staff in our schools. They remain instrumental in implementing safety protocols, altering schedules, and adjusting learning options when necessary. Their commitment to our students' well-being is truly remarkable, and I am proud to work alongside them. Our ongoing collaboration with the Department of Health and the Department of Environmental Protection ensures that school districts have access to the latest information and expertise necessary to evaluate the air quality conditions and make informed decisions. I would like to once again thank Governor Murphy for your leadership. Together with our dedicated educators and staff, we will continue to navigate challenges and provide the best possible learning spaces for our 1.4 million students. Thank you, Governor.
Thanks, Angelica. You good? Angelica, thank you. And I mentioned the folks who work and have no other choice, and on that list you'd have educators who are out there, hopefully all of them, if not most all of them, indoors. With the precious children in our state. If Pat Callahan were here, he could not be with us today, he would absolutely emphatically agree that the secret weapon, the hero behind the curtain at so many different dimensions of the COVID pandemic was our next and final speaker. Please help me welcome the Lieutenant Colonel of the New Jersey State Police, Sean Kilcommons. Sean?
Thank you, Governor.
Good to have you, buddy.
Thank you, Governor. I feel like I'm the guy to replace Derek Jeter on the Yankees, stepping in for the Colonel. Our State Emergency Operations Center at the Rock was activated earlier yesterday and has been activated to a level 3, which is enhanced monitoring. They remain in connected with the National Weather Service to assess the impact of the smoke on New Jersey and continue to monitor the conditions across the state. We're actively coordinating with many state and federal partners, such as New Jersey Department of Health, the New Jersey Department of Environmental Protection, and the Federal Aviation Administration, along with the Port Authority of New York and New Jersey, and along with New Jersey Transit. The state police and OEM have offered available state resources to assist our local, county, and state law enforcement partners across the state, as well as resources to the 21 state OEM coordinators. As the governor mentioned earlier, at 4 o'clock this morning, we made available N95 masks to 6 locations across the state, and I'll go over those locations again. It's Newark here at Penn Station, Hoboken, Secaucus, Trenton, Camden, and Atlantic City. New Jersey Transit staff will distribute those masks. And please, ask if you need a mask, ask for one. We will replenish the supplies if they run out, and they'll be available. Again, we'll continue to monitor this event. We have a great working relationship with Department of Health. It's their game. We're just there to support them in a OEM role. Thank you.
Thank you, Sean. Sean, I was at Jeter's last game. It was in Boston, and the pinch runner for him, which I always found humorous, was Brian McCann, who was the slowest Yankee. He came on as and you're no Brian McCann. You are a star. So thank you all for your comments. We'll take a few questions if you have them. Please.
Can you give us an update on the wildfires in New Jersey, and is that impacting air quality as well?
It is not, largely speaking. We had a significant occurrence last week in South Jersey, and I spoke with the mayor and a number of other officials. It was bad at one point. It was bad enough that they closed, I think, 25 miles of the parkway. And I drove through there a day or two later, and it was still hazy. But that is largely not only under control, but that's largely in a good place. This is overwhelmingly the Canadian fires. Please.
Two things. Are we seeing any signs of harm, like rising ER visits and so on? And second, are there things that people are required to do, like driving less to cut emissions, or are these things that we should consider to do in the future?
Yeah, on the former, and Judy will correct me if I'm wrong here, there was some anecdotal suggestion that ER visits were up. We don't think empirically that we've found evidence of that. But Judy, I think you mentioned this. You and I spoke before this. I know you mentioned it then. There is a significant increase in folks with asthma-related incidences. Is that fair to say?
Yeah.
Any more color on that you want to add?
Yeah, we're monitoring, obviously, all respiratory illnesses, and we did notice yesterday 143 individuals seeking care for asthma-related problems, which is the highest number that we've had on average in the last 2 months. You may recall 2 months ago we had the significant pollen situation, which you know impacts the respiratory system, and since then it's been pretty steady until yesterday.
Thanks. On the second question, if I may, we're not so-called, for the most part, requiring people to embrace certain behavior, but we're strongly suggesting across the board. Angelica mentioned this. If you're a kid in school, we really don't want you outside doing outdoor extracurricular activity. If you're vulnerable in any way, you shouldn't be outside. If you are, you should be wearing a mask. No need, at least at this point, to require that behavior. There are exceptions. Paramel Garg and I were concerned yesterday, late afternoon, by images we saw on the George Washington Bridge, Staten Island, as I recall, as well. The Port Authority implemented, at least yesterday, a 30-mile-an-hour speed limit on their bridges for the very simple reason the visibility was so poor. Less about polluting less, more about you couldn't see a foot in front of you. Please.
Commissioner, as someone who has asthma, I always carry a rescue inhaler on me, albuterol. Not everyone in the state of New Jersey who has asthma has access to that albuterol at a moment's notice. And when a parent has a child who's having an asthma attack or needs that rescue inhaler, they might seek it out and realize they can't afford it, or there's some roadblocks to it. So what is your advice to people who don't have that immediate access to albuterol or rescue?
The most important thing is if you see some worsening symptoms to either call your primary health care provider or go to the nearest emergency room or urgent care center to get care.
Good question, by the way. And for those who didn't hear it, what if you've got asthma and you don't necessarily have the proper stuff with you? And that's a great answer. Ma'am.
Just wondering, you closed state offices early yesterday, you opened late. Why let school districts make their own decisions under these extremely dangerous conditions, especially for young people? Some school districts have closed today, but it seems like they should have been closed yesterday when things were much worse, and schools closed during COVID. Yes, that was controversial, but it seems like maybe it should have been more drastic yesterday, not just keeping kids inside. I also read on some school districts' websites that they have limited supply of masks and telling parents that it's up to them to mask their children when they go to school.
Got it.
And what is the state doing about
I'll jump in, and Angelica, if I miss anything, you'll rescue me. We've only ever closed schools on a pan-wide state basis once in our history. That's not something that we take lightly, and when you've only done something once in several hundred years, that tells you that it's not a lever that we lightly pull. Secondly, and Angelica, I think, alluded to this, we have a very high concentration of state workforce in a couple of different places. We were deeply engaged with what the air quality was like in both Trenton and Newark, to pick the two biggest pods. We have over 600 school districts, and the reality is going to be very different at a local level, including to your very good question about access to PPE. So those are decisions we feel strongly need to be made locally in concert with the local health department or the county superintendent, county health reality. And there are a handful of districts that chose to not open today. Am I right? You said 5, Angelica?
5 is my
Yeah. So there's a handful that have taken that advice, and we respect those decisions. But we don't see, neither yesterday nor today, a need to make a blanket move on that front. Both to your question, to this gentleman's question, and to other questions, depending on where this goes, we leave all options on the table. This is another example of stuff that you and I have dealt with that, is kind of coming out of left field, and so options remain on the table, but for the time being, that's where we are. You good with that?
Yes.
Okay,
And
thank
do you
goodness.
speak to supplying masks to schools again, like you did during COVID? Is that something that could be on the table?
Potentially, absolutely, absolutely. But again, that's going to be a decision that's going to get made at the county level or even at the local district level, but absolutely. Mark, nice to see you, man. Long time.
So, Governor, with the increased...
Nice to see you, but it'll depend on what your question is. I should have said.
Living jacket after today, so come on. So, with climate change, the increased risk of climate change, these intense fires could happen more and more frequently in places like the Pine Barrens in northwest New Jersey. What preventative measures can New Jersey take?
Yeah. It's something that we're giving a lot of thought to. And while this is 10 to 12 million acres, think about that for a second. That's the range of the scale of this thing in Canada. That is the guerrilla event that is leading us to this gathering as we speak and the steps we've taken. We're not immune to this. At the basis of your question, and somebody asked us earlier, that we had our own reality last week, and we remain exposed. And unfortunately, the climate crisis has not just made the challenge more intense, but it's lengthened the period in which our DEP folks will, I think, support this. This has gone from a couple of months a year to 4 or 5 months a year, and unfortunately, the expectation is it'll continue to widen. So it's not just the intensity and frequency, it's the span on the calendar. So, we spend an enormous amount of time. We have one of the best firefighting organizations in America. They are outstanding. I meant to say this earlier. We probably have no better ally than Canada. So we're talking about all the impact of these fires on us, and we should be. But we also send our thoughts, prayers, and resources to one of our best allies. As of last night, according to senior Canadian authorities, there were 600 American firefighters in Canada, and that number was going up dramatically. But we spent a lot of time on things like cleaning up the forest floor. One of the concerns I think our DEP brothers and sisters would agree with, that one of the knock-on challenges from yesterday's haze, I think it's better in this respect today, but the watchtowers that we have erected at elevation to try to suss out where there may be fires were completely blocked by haze, which is a real concern. Thank God we got through the night in one piece, but we're not immune to this. Please.
Yes, Governor, we do keep talking about climate change, but if you can explain to residents what that means, like warmer weather causing these fires, especially in Canada, if you can expand upon that, why does this happen?
Yeah, I mean, there's always going to be, Smokey the Bear existed long before we were talking about climate crisis. So there's always going to be sloppy behavior, humans just doing something like boneheaded or malevolent behavior that's been around forever and always since fire was invented. So let's park that over there, and whatever we could do with the bully pulpit, public relations, law enforcement to limit that as much as possible. That's been a many decade, if not longer, endeavor. But the reality is temperatures are going up. Storms are more frequent and more intense, including thunder and lightning. We're getting more densely populated than before. We've got all sorts of elements swirling around that were always among us, but at a much lower level. And when you add up that intensity, frequency, and a longer runway each calendar year that you're dealing with these things, that conspires to lead to bad things in the environment. Maybe one more, please.
You said runway, so I have to ask you about Newark Liberty because these delays are mounting.
Yeah.
And out of the 3 area airports, it seems like we have to worry about the entire state and Newark Airport. So I'm wondering if you've been talked to.
We have. I don't have do any of my colleagues have a more recent, Sean, do you have an update in terms of average delays? They were running about an hour and a half last night, and that was the last number I got this morning as well. It is functioning. LaGuardia, by the way, was in worse shape than we were. Not that we'd wish ill on LaGuardia, but you're right. It's not just New Jersey, but it's the tri-state air reality, which includes obviously LaGuardia, Kennedy, and most importantly for us, Newark. Maybe one more.
Yeah.
Brett.
So I know you mentioned conditions today and tomorrow. Is there a sense when the air will clear? Do we have that yet, or is there not a time?
And what's your second one?
That's it.
Oh, that was it. Jeez. Katie, you want to?
Usually I have 4. So.
Yeah, I'm impressed. What's your gut tell you in terms of timing here?
Well, I mean, I think we're looking at the next few days for sure. As we said, the action alerts are active for today and tomorrow, and it really does depend on the wind and the weather. So it's difficult to predict, but I think we're in it for another day or two at least.
Yeah, I doubt, thank you, Katie, I doubt we'll be gathering again like this tomorrow, but I think to underscore what Katie's point, I think almost certainly it's the next day or two at a minimum. And again, I'll leave you with everybody. First of all, go to this website, airnow.gov. It's a really good place to go. Secondly, don't panic, but use your head. Use common sense, particularly if you're in those vulnerable categories. Little kids, seniors, adjacent health challenges like lung, heart, asthma. Do the common sense things, and I think most importantly, stay inside with the windows and doors closed. So I want to thank Judy, Angelica, Katie, Sean, Paul, and the rest of the team for being with us today. Thank you.